I'm an orthodontist, a specialist in orthodontic dental-facial orthopedics since 1993. Since 1992, I graduated in Hebrew University in Tel Aviv, in Jerusalem. And right from the beginning, I started to use lingual orthodontics because I went to courses by Dr. Didier Filion, Dr. Gorman. I was the president of Israel Society. I was also one of the founding members of WSLO, World Society of Lingual Orthodontics. And I'm now teaching lingual orthodontics since 1999. I'm teaching in the international program in Tel Aviv University. We have an international program with participants from all around the world. And I'm teaching them lingual orthodontics right from the beginning of their study. So they study lingual and labial all together. And that's all. If we compare it to the patient, the most aesthetic appliance is lingual. It is much more aesthetic than the labial, than clear aligners. What you mean? Because clear aligners, first of all, you see the clear aligner. In lingual, you see nothing, and you always have these attachments in the Invisalign, in the clear aligners. But this is not the only difference. One of the main differences is that you are totally dependent on the patient cooperation, and if the patient is not wearing as you tell him, then it will not work. There are other differences considering the mechanical differences, because in lingual you can do all the movements exactly as in labial, but in clear aligners you are very much how do you say, restricted. Less movements are possible to create. Okay? And therefore it is also unexpected considering the length of treatment, because sometimes you need to do after re-evaluation and refinement and do again the treatment plan in clear aligners, but in lingual it is much more expected, the treatment lengths and time. I usually prefer adult patients. Sometimes there are some children who are trying to have also lingual brackets, but I think it's not very suitable for them because of the oral hygiene is more difficult to control, and we cannot control the children as we control the adult patients. And also if this is during the transition of the dentition, then we cannot have accurate brackets position because the height of the bracket is not correct, and also the gingiva did not expose exactly the surface. So I prefer adult patients. I think it is more suitable to adult patients. They should be very well motivated with good oral hygiene. This is of course, with the big teeth and the beautiful face and everything. To my opinion, it is very easy, but you know, I have a lot of experience, and now it's easy for me. And now the length of treatment is not more than with the labial patient. The length of treatment is the same, but you need a lot of experience. You have a learning curve. It takes time how to see how the movements will be created. Okay, it takes time to learn. Of course, the indirect bonding with the lingual, it makes it very, very easy, and the bracket positioning makes it the customized bracket positioning and the customized bracket make it much more easy than before. So I don't think it's a difficult technique now, but we still need a learning curve. I think the main problem is oral hygiene. That's all. Oral hygiene. Okay. I recommend them to use appliances like water pick. There are some water picks that are connected to the tap, so it's very easy. Most of my patients have very good oral hygiene, if they use this kind of water pick? Well, the treatment time is about, it depends of course of their malocclusion. If normal malocclusion in adults without extraction, non-extraction, it takes about 1 year, sometimes even less. Even less than 1 year, 8 months, this is at least 8 months. But if you have extractions and space closure, it will take 2 years, usually. First of all, I think you have to be very proud of yourself with this eBrace appliance, because it's really a wonderful appliance and it makes it much more easier for the orthodontist, much more comfortable for the patient, and I think it has a great future. I'm sure that it will go very, very good in China. This is what I think, but I think it's a wonderful appliance, and really it's a wonderful advancement. I think it is the future for orthodontics, and I'm sure that this will go very well in China as well as worldwide. This is the future of orthodontics, lingual.